Hi, thanks for joining us. We are going to hear tonight from Donna Rasmussen from the Consumer Credit Counseling of McHenry County, and she's going to talk a little bit tonight about your financial health during the COVID-19 crisis. So, Donna, here you go.
Right. Thanks, Carrie. Hi, everybody. I'm Donna. I'm the financial literacy educator at Consumer Credit Counseling Service of Northern Illinois. And we are a not-for-profit. We've been in Woodstock up here in the very northern part of the state for 39 years now. And we have been providing counseling services for housing and credit and debt management at no cost to clients for all of that time. So we are grant funded. So if somebody would like to meet with a counselor to either review their budget or create a budget or talk about their credit report and scores, we can set up an appointment, and they're all by phone or Zoom right now. And it is completely fee-free because of generous grant funders throughout McHenry, Lake, and King County. So tonight we're going to talk about financial health during the COVID-19 crisis. And this workshop was developed back in May of last year when, we'd all been home for a month and a half, and nobody was really meeting anyone, even really on Zoom too much. And I thought, I'm going to create this and see where it goes. Well, it's now becoming and continues to be one of our most requested workshops. So we're going to talk about a lot of things. This pandemic has not discriminated against anyone. It doesn't matter how much money you have, how little money you have, how educated you are, how big or small your family is. Everyone has been impacted by some aspect of it. Most people have been affected by reduced income, either through a layoff or reduced hours, and that is a big problem for people because it not only affects your wallet or your bank account or what you can and can't pay, but it affects a lot of other areas of your life. So we want to try and help people manage at least a little bit, manage some of those concerns while we're going through this whole pandemic still. So the importance of self-care is everybody, you hear them saying this to moms of little kids or moms with kids with disabilities. You need to take care of yourself. Well, as moms, I know I am always like, oh yeah, I'll do that after the kids are in bed, or I'll do that after they get out of high school or out of college, or but we really do need to take care of ourselves, because if we're not taking care of our inner self and our self, mentally and emotionally, we can't take care of everything else that we're responsible for as humans. So we're going to watch a little video about self-care and why it's important. We might have to watch a commercial because I'm cheap and I don't.
Today we're going to be talking about showing up for yourself.
Oh,
So when there's a lot going on in our lives, in the world, when it feels as though there's just no more space in our mind, it's really tempting to let go of the things that are most important to us and the things that are going to keep us healthy and well. And now more than ever, it's really important that we focus on those things that are going to keep us healthy and well. So as much as possible, if you can, find a time to meditate. Find a time to step out of the thinking mind, to rest the thinking mind, and just be present. Make sure you're taking time to exercise if you can. Most of the gyms are closed down. It might mean going out for a walk. It might mean going out for a run. It might be doing something at home. But whatever it is, make sure that your body's getting some kind of physical movement. Make sure you're getting enough sleep. Sleep is so important. It's important to our immune system. It's important to our cognition. Don't get enough rest, then you're going to compromise all kind of different aspects of your health. eating right now, eating's going to be difficult for all of us, and we may not get everything that we want, but continuing to eat as healthily as you can is going to be a really important part of staying healthy and well. And then finally, finding a sense of play in your life. In the middle of a global pandemic where so many people are suffering, and maybe people really, really close to you are suffering as well, play and a sense of joy can feel so far removed and perhaps even unnecessary in our life. But if we can find even a couple of moments in the day where we smile, maybe even laugh, find something that brings us a sense of joy, that has a very real impact, not just on our mind, but also on our body. So just making sure that you're looking after yourself. Remember, it's not selfish. It's not just for you. It also benefits the people around you as well.
All righty. So I love his accent. And I think I love it more every time I watch that video. It's so true though. All of the that blue color is so pretty and it makes me want to start coloring or painting or something. And those are the things that I think I started doing more of once the pandemic really kind of made us all hunker down. I did not do things like reading a book. I don't think I read a whole book during the whole time we were on lockdown. I don't think I read even a chapter of a book, but I did a lot of coloring, a lot of painting, played a lot of games with my kids. And that helped to kind of give my mind a rest from all of the pandemic-y stuff. So like we just said, our physical health, social health, emotional health, and our financial health, it's all important and we need to take care of it. And that social health was really interesting during when we were allowed to go out and walk around. And I met so many people in my neighborhood that I had never even seen before. I think they all got dogs during the pandemic because I would always walk my dogs and I never saw these people. And then all of a sudden there's dozens of people walking dogs and we're all on the opposite side of the street. But I think animals really made a lot of people whole during the pandemic too. So that, and it helped with our social health. So when you're struggling with the physical part of it, getting out of bed and just, not really finding the energy or feeling like there's, nothing really to make you get out of bed, that can be a problem. And especially if you're not having any social activities. Now it's a little easier because things are opening up and we can eat outdoors, even, we just social distancing, but we can still meet with people a little bit more than before, but we want to make sure that we're having meaningful interactions with people, not just, this hello and goodbye thing, talking about asking people how they are, how their families are, and that kind of thing. Processing all of that information that we're getting right now can just put a real strain on your mental health, especially over the past winter when we saw that election craziness going on and the holidays and just everything in your mind all at once could have been really tough. And then trying to engage in activities while that's going on, things that you normally find enjoyable. Well, I know I found it very difficult. I couldn't put the television on, even to turn it on and then hurry up and turn it to Netflix because there would be some news thing on that I just did not want to deal with. I didn't go on social media a whole lot because I didn't want to see any news. So just not being able to engage in activities can be draining, and we need to find a way to get to where our emotional health is our needs are being met. And then lastly, but not leastly, your financial health. If you're feeling all of these strains and drains from your physical health and your social, mental, and emotional health, maybe you're not taking care of those financial responsibilities. Like, do you have some, are you forgetting that your credit card payment is due on the 15th and, and then you have a late fee and then that can add stress and It can cause you to lose sleep at night. So your physical health is affected again. So there's all these worries that that over the course of that whole pandemic really were bothering me. And I guess that they were bothering a lot of other people too. So the first thing you need to do if you're feeling that kind of way is talk with someone you really trust, your partner, a close friend, your doctor, if you're, in recovery, or, you have a case manager or sponsor. Talk with those people and let them know how you're feeling. And then they can help you get the help that you need. Because sometimes it's hardest to help ourselves. And then get outside. And now the weather is, I don't really want to call it nice because I was freezing all day today, but it's getting less bad. So I don't have to use my snowblower to go get my mail. So that's good. So take a walk your dog, or walk someone else's dog if you don't have one, or just walk by yourself even. Yoga, there are tons of exercise programs online. My boss has been doing yoga on Amazon Prime. They have yoga classes on Amazon Prime. Netflix, of course, has, a ton of exercise things that you can do, and YouTube. So there's always a way to get your body moving, and that will get those endorphins going so that you feel a little bit more like you want to get out of bed, you want to be social, you want to, well, maybe you don't want to pay that bill, but maybe you'll do it on time, right? So we're going to talk a little bit, we're going to listen to another video where they're talking about all the different ways you can maintain your health. Oh, no ad.
Right now, we are living in, and it's normal to have a response where you're feeling anxious or stressed when abnormal things are going on. There are a number of things you can do to maintain your wellness in a difficult and stressful time. The first thing I like to talk with people about is the idea of making sure you do a good job of maintaining a boundary between work and home. It's really easy to forget the boundaries between the two, so that your work and home life balance bleed into each other, and that can lead to a lot of stress. In order to stop that from being a major problem, we're recommending that people are a little bit more vigilant in their scheduling to make sure that there are clear, demarcated boundaries between what's work and what's home. So making sure that you have built-in time to your day to take a break from work, to get outside, and to really not be focusing on work is an important first step. The second thing people are struggling with is time management. One of the biggest problems we're finding is that we all have a lot more stuff on our plate, and it's really hard not to feel like we have to attend to everything. So it's really important to also maintain a tighter schedule and be more consistent with people who you're working at a distance now with at what you can and can't get done. The third thing that's really important in order to maintain your wellness is to make sure you're getting a proper amount of activity and you're actually getting outside of your house as much as possible. So we're recommending that people maybe increase the amount of things they're doing for physical activity, creating that routine of activity, whether it's intense exercise or just getting out and going for a walk around the block with a loved one, is something that you're making sure happens on a regular basis. A fourth thing that's really important is to make sure to work time in directly devoted, and in particular to activities that help you cultivate other interests. For some people, that means starting to cook home-cooked meals more often or more regularly. For others, that means playing board games, and still others are starting new hobbies. All of those things can be great for helping you maintain a sense that there are other things in your life going on and filling your time. If you're struggling with excessive anxiety, worry, difficulty sleeping, difficulty with depression, those are things that behavioral health providers are absolutely standing by and ready and waiting to help you. Please know that at University.
So did you see that character with the frying pan on fire? That's what it looks like when I cook. And my daughter will always yell out, "Dinner's ready," when the smoke alarm goes off. So, but I do know a lot of people who took cooking classes online and learned how to make some really wonderful things. I'm not that great of a cook. I usually just chop up a salad and throw it in a bowl, and that's what I have. So that leads us into what we eat really does affect how we feel. I know when I'm eating sugary things, like I have a real problem, say no to chocolate. And when I do eat a lot of milk chocolate, I feel like my hands swell up at night when I'm sleeping. And I thought maybe I was having like arthritis or something like that. And I did some research on it. And yeah, the sugar in candy and sweet things like that will cause inflammation, and it can be why some of us wake up in the morning and it's hard to like straighten out or bend our fingers. So limiting those sugary snacks is a big struggle for me now. Now that I've gotten rid of a lot of the bad sugar things in my house, it's a little easier. I still have to go into work where everybody has those candy bowls, and somebody's kid is selling a candy bar for a soccer team or something. So it's still a struggle for me to say no. But cutting down on processed foods is another way that we can help our body, and that can improve our mood. So that MSG that's in those foods that have require being preserved. So anything processed or canned, those kind of things can, while you think you're eating, can't even think of something that's canned. Tomatoes, because I don't really use canned foods. Tomatoes in a can, while they might seem like, okay, yeah, I'm going to make salsa and use these canned tomatoes, and they have a lot of preservatives in them, and I think they can be affecting people's moods. Now, this is stuff that I've actually thought, but this is actually from a New York Times article from a couple of years ago. So fresh fruits and veggies are always going to be better anyway than canned, but they can be better for your mental health. And here I see that I have a little error, and it says your mental health. So I just noticed that after doing this workshop for quite a long time. The Mediterranean diet can lower your anxiety levels as well. Now, I didn't know this either until I read this article like 4 or 5 months ago. But I know that, people who eat the Mediterranean diet usually don't have a problem with their weight, and, it's supposed to be heart healthy, but I did not know that the seafood, grains, and greens help to lower anxiety levels. I know spinach is a great one for a lot of things. And so maybe that's part of it too. I eat a keto diet for the most part. That's why I don't have any chocolate in my house anymore. So I don't eat grains, but I do eat, I just found pancakes that I made with almond flour, so I can have what feels like a pancake. And it's my life has been so much better the last 2 weeks that I could have a pancake again. So they say that you should eat the rainbow. And I have a friend who is from Croatia, and she's like, what does that mean, eat the rainbow? And I said, Roy Begiv, don't you know Roy Begiv? And Roy Begiv. And she's like, I don't know what that means. And I said, it's red, orange, yellow, green, blue, violet. And so if you eat all the foods that are all those colors, you will have a smile. You'll have better mental health. So we're going to watch this little video here. I think this might be our last video for the evening. See if I can get it to, there we go. Oh, no more ad. That's great.
Here are some tips for eating during stressful times. It's really important that we fuel our body with the food that it needs throughout the day to keep ourselves from getting too hungry, to keep ourselves from getting too snacky. Let's make sure that we're eating 3 balanced meals a day. When we do want a snack, let's put that snack in a bowl or on a plate and find a place to enjoy that's not in front of our computer screen. So it's very likely that when we're working from home, we turn the day into an endless grazing session, and we end up eating a lot more snacks than we normally would have if we were at work. So when we need those snacks, let's make sure that we plan that snack out. We build a healthy snack with some protein, some complex carbohydrates, and sit down and really enjoy that. The other thing we want to make sure is that we're setting up our new work environment for eating success. Research shows us that we are 30% more likely to eat what we see first. That means we want to put the chips and the candy in the cupboard behind other foods so that we have to remember. And we want to put something healthier that we want ourselves to eat more on the counter, like a fruit bowl, or maybe some veggies that are cut up in the front of our refrigerator. So when we open that refrigerator, that's what we see first, and that's what we're enjoying first. Another important tip is that we make sure that we keep food out of arm's reach. Research shows us that we are 3 times more likely to eat something that we can reach with our hands. The other thing that can help us is eating out of smaller bowls, off smaller plates, and even using smaller spoons. So research shows that we eat 50% less ice cream if we use a smaller spoon and a smaller bowl. And last but not least, if none of this seems to work and we're still feeling stressed, let's change our environment completely and go outside and go for a walk and get some fresh air. So let's use those tips to help us enjoy the things that we want to eat while we're at home, but not overindulge.
All righty. Okay, that's my cat walking back and forth. If you can see, her tail is walking in the way here. So she's a tiny kitten. We just got her. So when I put ice cream in a smaller bowl, it just means I have to get up twice to have ice cream because I can't. I don't have ice cream in my house any longer either. So when we talk about getting information and, watching the news and trying to not get stressed out, we still need to be able to access reliable information to keep us current, but we want to step away from the computer or the TV or, the other computer. So we need to really stay away from loading ourselves up with all of this stressful information. And the way I found to do it was shortly into the pandemic. I started watching dog TV, and my dogs will sit with me. Now you can hear my dog eating her rawhide right now, but my dog will come sit with me. Sometimes both dogs will sit with me, and we watch little puppies chasing around rabbits or butterflies, and it keeps my anxiety level down and keeps my stress level down. And sometimes I find that I do it for like a whole morning. So if that's what we have to do, is watch dog TV to keep us from being overloaded with, pandemic information, then I'm all for it. So, and then also, again, get outside. That's getting the vitamin D and having the wind, the breeze in your hair, and maybe digging in the dirt a little is always helpful. So limit that social media news. I know I feel like when I search one news thing on social media, then I get bombarded with a whole bunch of other news updates. So I really don't look to social media for any kind of news. You can always contact your library for credible information or sources for credible information if you really can't find anything and you don't want to turn on the TV. And you can always call our agency too. Our phone number is 815-338-5757. So right now, when people are struggling with financial worries and maybe less income and not being able to pay credit card debt on time, or, we know there's the mortgage forbearance and student loan forbearance, and, these things are ongoing for the time being. But credit card debt is still, a lot of times, people just think I can't pay it. I just have to, take a late payment fee, or I'm going to have a 30-day late on my credit report now. But that's not true. Most creditors are willing to help, and they want to get their money just as much as you don't want to owe more money. So they may, if you call the number on the back of the card and just talk to somebody about a workout plan, because I have less income, I've lost my job, whatever it might be. Creditors are willing to sometimes lower interest rates, so you're not accruing as much interest, and they might also lower your minimum payment so that you pay less, you're accruing less interest, but you're still making an on-time payment, and maybe you're able to pay a couple of other debts as well. So if you can call your creditors, any creditor that you have, and maybe you can get some type of a workout plan. If you try this and you really don't have any luck, the wait times probably might not be as long as they were earlier in the pandemic. But if you're having a hard time getting any results or resolution, reach out to a credit counselor. It doesn't have to be one of ours, but find a reliable, not-for-profit credit reporting or credit counseling agency, and reach out and talk to a counselor there. Try not to go to a credit repair company. They are just going to charge you large fees to dispute real information on your credit report, which will come off for a short time and then will go back on. So that's the way they kind of make their money. So try and find an agency that is, reliable and is accredited by the NFCC, the National Federation for Credit Counselors. And that is our agency is, but there are other consumer credit counseling services if you live further away. The CARES Act has a forbearance and credit reporting requirements, and they may apply to you. Some lenders, mortgage companies are required to report accounts as current because the government is giving them money to, so they can implement these forbearances or relief programs. So your lender may be one of those agencies. So you need to reach out and find this information out. They might be waiving late fees, and they may not be reporting late payments to the credit reporting agency because they're getting that help from the government. So right now, the credit reporting agencies, Experian, Equifax, and TransUnion, all realize that people are struggling. People's credit, a lot of people's credit is impacted by their lack of income or reduction in income. So they've made it possible for everyone to check their credit report every week from now through April of next year. So you have like 54 or more weeks that you can check your credit report every week. And you should do it. And you don't have to check all three of them and like go through them line by line, but pull them up. I just pulled mine up the other day. Pull them up, download them all to your computer screen, and then pull them up when you're having your morning coffee and just kind of compare them. Make sure that everything you're paying is being reported correctly. It's the amount you're paying is being reported. If you've paid off an account, make sure it's being reported as paid in full. If you have a collection that's on there and you've paid that off, make sure that's, being reported right. Make sure that there's nothing on there that isn't yours. And you can also go, when you're on the credit reporting website, it's www.annualcreditreport.com. When you're on that website, you can also request to add a permanent comment to your credit file. And you would put something like, I have been negatively impacted by the pandemic. So then in 2 years from now, when this is all over and you're thinking about buying a house or a car or something like that, or you're applying for work, the creditors are going to pull up your credit report and they will see on there that you've got this statement, and it will explain that maybe that's why you had 3 late payments in January of 2021 or in August of 2020. So that permanent comment will kind of alleviate any problems that may come up for, because of, late payments. So when you're contacting your creditors, excuse me, you want to ask a lot of questions. So if they don't see anything on their website, you want to ask them, what type of hardship or relief programs are available, and are there fees? Ask if you can defer payments to the end of your loan. So if you're talking about a car loan, an installment loan of some kind, can this money be pushed back to the end of my loan? And so it will be really helpful to a lot of people, but you do have to remember that the interest is still going to accrue on that money throughout the term of your loan. And you're going to be paying more as a whole because that is going to extend the term of your loan. Find out if interest is accruing during the relief period, because like student loans, the interest is not accruing. And you need to find out from your other lenders if interest is still accruing. Then find out when you need to start repaying and what are the options at the end if you have problems paying. How can they help you if, you know, the pandemic is over? My cat keeps jumping up here. The pandemic is over and your unemployment is, you know, you're still working for, you know, less hours or less wages. How can they help you then? And then if you're getting relief, like a forbearance or something on a credit card, make sure you ask if you can still use that card, because a lot of people have been relying on their credit cards to pay bills. And if that's you and you still have the availability to use your card now, asking for relief may preclude you from using your card during this time. The CARES Act has special requirements for companies that report to the credit reporting agencies if they are providing credit relief due to coronavirus. So those companies have to like give their clients, their, you know, borrowers a break. So when you contact your mortgage company, you've got to first get your mortgage statement out. Make sure you have that statement handy so you have all the information that you need. You need their lender name. Of course, it's going to be on the statement. Their contact information is going to be in there. And then you want to go on the website first to look and see if they've got any kind of hints or information about additional hardship or relief programs. Ask about those when you call. Find out what the terms are. How is any payment or forbearance or non-payment, how is all that going to be reported? And how is it, what's going to happen at the end? Is it rolled into the end of the loan? Is it going to be a big payment that's due? Because that's typically what happens during a forbearance. All of the money that you've pushed off, that, you know, you've got a 6-month forbearance. At the end of 6 months, most of the time when you get a forbearance, like with a student loan, it's not a federal loan. A private student loan. If you get a forbearance, you're going to pay that 6-month payment. They're going to expect it when the forbearance is over. So make sure you know all the facts about what your forbearance is going to require of you. The forbearance that the government is implemented with mortgage companies, those payments, I'm not sure what happens with taxes and insurance and all that kind of stuff. But I think for most people, they're going to want to roll that into the end of their loan, but you'll have to find out for your specific situation. So after you're done talking to all of your lenders and creditors and everything, you need to make sure that you do these things before you hang up the phone. Confirm with them what they expect from you and what you've agreed to. Ask them to email it to you or mail it to you in writing so you have a documented, you know, it's in writing what you've agreed to, and they can't, you know, everybody understands what's happening. Make your payments in full as agreed. Don't make a partial payment. If you're unable to make the full payment, call them before it's due so that maybe they can work something out with you. Check everything for accuracy. Make sure that all the amounts you're supposed to pay, the account you're paying it to, everything is accurate and all the numbers are in the order they're supposed to be in. Keep checking your credit report. You don't have to do it weekly, but at least once a month, now that you can, check your credit report as often as you can. And if there's errors on your credit report, dispute them. You do it in writing, you do it through certified mail. There's our credit counselors can help you through that process, but there's information on how to do that on annualcreditreport.com. And then you'll need to have documentation to show the information you're disputing. So if you say that you've paid off a debt and they're showing on your credit report that it's not paid off, have your bank statements available, have the, you know, if you've got some type of a thing that said paid in full, have all of that information, send copies and send it certified. So make sure you reach out to your lender before the end of your forbearance program if you're not sure what's happening next, and work out some kind of an agreement of how that's going to get repaid. And scammers, you would not believe how many scams are out there right now. I just read about 4 new scams just today on an email I get. It's all about scams. So now there is a support animal, a service animal scam where now the airlines do not have to allow emotional support animals on the plane, probably because people are bringing goats on the plane and horses. I don't know if you saw that, but so now you can't bring an emotional support animal on a plane. So there are scammers out there that will call people and say, we can give you, for a fee, we can give you a certificate that states that your animal is a service animal. And it's not true. There is no association or organization that issues a document like that for a service animal. You have to have a proof of your disability and proof that, you know, that the dog is a service animal. And you can get that from your doctor. And there are places that help you train a support animal. You can get documentation from them. A lot of people are reporting that they are getting calls from people saying they're contact tracers, asking for either a credit card number or a bank account number. They are not going to ask you for money. They are strictly calling you to let you know that you've been in contact with someone who has tested positive for COVID. That is the only thing they will tell you, and they won't ask you for money. So contact tracers are not asking for money. That is a scam. If you have received anything from IDES, the Illinois Department of Employment Security, you should call them and report it, because and open the mail that comes from them. It's not, chances are it's someone who has applied for unemployment in your name, and you need to contact the unemployment office to let them know that this has happened, and they can tell you the steps to take. So just be on the lookout for all kinds of scammers. So if you've gotten a student loan forbearance, if you have a federal loan, your forbearance ends September 30th. So as of right now, on October 1st, you'll have to start making your student loan payments again. You can still make payments, and really, if you can, you should, because right now interest is not accruing. So every payment you make towards your student loan, the entire payment is going towards your principal. So if you can make a payment, you should do it. You don't have to because of the forbearance, but boy, it would really be nice though, to at the end of this whole pandemic, see that your student loan debt has decreased instead of stayed the same or grown bigger. If you are participating in the public service loan forgiveness program, even though you're not making payments, your time is accruing. So it's still, the months that you've been in forbearance are still being added to the 120 months you have to do in order to get your loan forgiven. A lot of times, if you have a private loan, it's not a federal loan, you may be able to get a forbearance, postponing your payments or lowering your monthly payments. But most of those loans are not in forbearance. So you should contact your student loan servicer if you have not been making a payment. A lot of times those private loans, the interest is continuing to accrue. So now we've done all the stuff, right? We've applied for unemployment, you've contacted your creditors, you're trying to make student loan payments because you're trying to help that mountain of money due go down. So now what you need to do is create a budget, and you need to make that budget based on your new income, which is reduced hours. Maybe you got a stimulus check or two, but maybe you're getting some unemployment, but that is your new emergency budget. And hopefully it's just short term, but it's, we're going to have to cut out all the fun spending categories. So one thing I did in the beginning of COVID is I used to have Hulu. We have always had Netflix, and we used to have Hulu, and we had Sling occasionally. So we cut out Hulu and Sling. And when The Handmaid's Tale comes out again on Hulu, I'll get Hulu for that month. I'll watch the whole show, and then I'll cancel it at the end of the month. So don't tell Hulu that, but that's how I do it. So if you can rotate the streaming services that you have, just so that you can maybe have only one at a time, that's a really great way to cut, $10, $15, $25 a month out of your spending. Because I mean, it's nice out now. We really shouldn't be watching that much TV anyway. If you have memberships to the gym, cancel them if you're not going. If you're working out at home or outside, who needs a gym right now? And besides, my daughter lives in Minnesota, and she went to the gym the other day. She said it is so uncomfortable wearing a mask the entire time you're working out. I just can't even imagine. So we've been working out here at home. So list all your remaining obligations and make those tough decisions. If it's not necessary, cancel it. You'll be able to get it back when this is all over. There is one more little video here. So I don't want to run out of time. So if you still need more help and you're not able to make ends meet by doing all the things we just talked about, contact your local township or your village hall. There's charities and churches in our area that provide a lot of assistance. They will provide emergency funding for rent or utilities. Food banks are all over, and a lot of food banks are having to throw food away because they're getting so much food. So if you are struggling and you need help with groceries, contact your food bank because they have the food to give. If you're on Medicaid or SSI, you can get extra help. That's a small stipend, like $60 or something, that will help you with over-the-counter medical supplies, bandages, maybe hydrogen peroxide, those kind of things. If you aren't already on LIHEAP, contact your local community action agency and fill out an application for LIHEAP. And we now, right now in McHenry County, if you go to www.mchenryrent.com, you can find out if you're eligible for rental assistance through our county. And that is, COVID related reduction in income. And our agency we are navigators, and so they can help you figure out if you qualify for that. And we all know 211 is a great organization. It's part of United Way. And if you don't know where to turn, you can dial 211, or you can go to 211.org and take advantage of some of the
when you or someone you care about needs a helping hand. Remember 211. That's United Way's 24/7 help and resource referral line. From basic needs, housing, utilities, and food, to childcare, elder care, healthcare, and mental health services, United Way 211 is here to help. The service is free and completely confidential, so don't try and go it alone. Get connected with local health and human service provider and get the help you need with United Way. Dial 211 anytime, any day.
So 211 is everywhere. And now in Lake County and McHenry County, and I think in Kane County too, you can text 211, but there's a special like 888-211. I'm not exactly sure what it is, but you can dial 211 and find out about the texting. So make sure that you have all of your basic needs taken care of. You've got food, you've got your rent covered, you've got an emergency fund. And if you get that stimulus check, if you haven't gotten it yet, or your tax refund, try to set aside some of that money. If you need to make a car repair, or you just need to have money for gas, set some money aside so that you can, I know it's hard to not do the fun stuff. But if you can set some of it aside so that you can get the hard things, the important things done to get you through this time, it'll pay off in the end. So you're going to take care of yourself. You're the most important. Without you, the rest of your squad can't, they need you. So utilize community resources. Use 211 if you are struggling with food deprivation, mental health issues, housing issues. Contact 211. Find reliable information. The library or our agency. Use your income wisely. Try not to, spend, recklessly. Call your creditors to make payment arrangements and utilize and use an emergency budget. And if you need help, you can call us. You can contact us through our website or our email address, info@illinoiscccs.org. You can also go on our website and shoot us an email from there. But we are in 3 counties, so we're always available to anyone who needs us. And be sure to like and follow us on Facebook and Instagram. We're pretty active, and you can hear my dog walking around, and on Facebook and Instagram, you'll be able to see my dogs. So and then this is a QR code. If you are not watching this on your phone, you can use your camera to download, it'll take you to a Google Doc, and that goes directly to me. We do not collect emails. You will not get an email from me. It just is a few questions that will give us information on how our presentations are, if we've helped you, in what areas we've helped you, and it helps us to move forward and provide good service. And that is it. There's a lot of information.
All right. Thanks, Donna. We really appreciate this.
Yeah, thanks for having me. We always like to, we love coming to our libraries, and hopefully soon we'll be doing it in person.
I hope so.